My wife Peggy and I have been together for about 35 years. Since she was diagnosed with MS about 10 years ago, I've been her primary caretaker. And there have been a lot of challenges for both of us, but we've somehow managed to make it through. But not too long ago, the tables were turned.
John has always been the one helping to care for me, so it was really scary when he came in from the backyard one day and said he wasn't feeling right. I became concerned right away.
I was out doing some yard work, and all of a sudden I felt these severe chest pains, really sharp, and I thought maybe I'm overdoing it. Then it got worse, and I felt my arm go numb as I started to come back into the house.
When John said he was having chest pains, I was so scared. When it's happening, it's hard to know what it is.
You know, at that moment, you're not really thinking about what medications you've taken or the conditions you've had or even the tests that you're being given. Well, they did do a chest x-ray and then a series of other tests.
Fortunately for us, we didn't have to keep track of all those tests and things that happened that day. HEALTHeLINK did it for us.
After John was discharged from the hospital, he came to see me in the office for a follow-up appointment, and I noticed that he had had an abnormal chest x-ray when he was admitted. The radiologist who read the chest x-ray film had recommended a CAT scan to see if there was anything serious going on, such as lung cancer.
Dr. Sunday asked me if they had done a CAT scan, and it was really hazy that day, and I couldn't remember exactly, but I just told her I didn't think they had done a CAT scan.
I went on to HEALTHeLINK and I looked up his hospital tests, and I found that they had done a CAT scan, and thankfully the results were fine. I didn't have to have my office staff call around to track down his results. I could look up his results right on my computer. In this case, HEALTHeLINK saved John from unnecessary and duplicative tests. He didn't have unnecessary costs, he didn't have radiation exposure, and he didn't have to waste his time.
Thanks to HEALTHeLINK, the emergency room doctor was able to see the patient's medical history. HEALTHeLINK also ensured that Dr. Sunday, the patient's primary care physician, received results of all the tests that were run.
HEALTHeLINK is the clinical information exchange for Western New York. We're powered by Optum, and we support the physician community here in Western New York by helping them get the data that they need so they can better treat their patients.
I was one of the first physicians in Western New York to use HEALTHeLINK, and now nearly all of my patients have consented to have their health information available through the clinical information exchange. HEALTHeLINK gives me access to the information I need, when I need it, where I need it. I can see at a glance what's happening with the patient throughout the healthcare spectrum, whether he's seeing me or another provider. It really is like oxygen. I can't imagine practicing without it.
What excites me is the limitless potential of what technology can do to transform healthcare and to really make a difference for patients in our community and really in the country. We're excited about the role we can play in improving the coordination of care, the quality of care, and lowering the cost of care in our community. We are just beginning to see the benefits of what technology can do, and that really the sky's the limit.
Knowing that the healthcare system is connected, that my doctors know the tests I've had, the medications I'm taking, and my medical history gives us both real peace of mind. Even if I can't speak for myself, I know that HEALTHeLINK will speak for me, and knowing that all my care providers are connected is a really good feeling.